So our third story from the heart today is from Dr. Jacob Weasel. Jacob, he said I could call him that, is a son, is a husband, is a father, and is a healer. He's a member of the Cheyenne River Sioux tribe. He is our newest general surgeon here in Rapid City. And he has been on a 15-year journey to join us here at Regional Health and become the surgeon that he envisioned himself to be. He is going to provide his story titled The Anatomy of a Calling. Please help me in welcoming Dr. Weasel to the stage.
I'm going to pull up this chair, this stool, just so that we can sit and have a chat for a little bit. So I'm Jacob, and as John said, I'm a new general surgeon here at Regional Hospital. And at the age of 16 years old, I felt a calling to pursue a career in medicine, and not just medicine, but surgery in particular. And the pursuit of that calling over the past 15 years has brought me both my greatest trials as well as triumphs. It's brought me seemingly insurmountable obstacles as well as some amazing opportunities, and the pursuit of this calling has come at a great sacrifice to me and my family, but it's brought an even greater sense of satisfaction. And as I pursued this calling in surgery over the past 15 years, there are a few things that I've come to learn, and really that's what I want to share with you today. I've entitled this brief talk, The Anatomy of a Calling, because just as there are many parts to the one body, so too I believe that there are key attributes that will define anybody's calling in life. And it doesn't matter today whether you're a nurse or whether you're an educator, whether you're an administrator or whether you're a physician. I believe that there are key attributes that will define anybody's calling. And the first trait that I would suggest to you today that will mark our callings both collectively and individually is that of service. And I've had the opportunity to listen to Paulette talk over the past couple of weeks in the town hall meetings and at our provider meeting about how she got started in healthcare. And I just have to say thank you, Paulette, for sharing that. Because for me, and I'm sure that there are a lot of people in this room that would agree, for me, my story is very similar to your own. And you got started in healthcare by cleaning hospital rooms and cleaning beds. And I got started not in cleaning hospital rooms, but by wheeling patients to and from their various tests. And I was in the patient transport department. And at that time, we weren't transporters. My title at that time was a patient escort. And yeah, and so I say that, and don't get me wrong, I am not suggesting that we take our transport department and retitle them as the escort service, because my concern, obviously, is that the Journal would get a hold of it and there will be an article, Regional Hospital opens new escort service. That's not my, but I say that only to say that as a patient transporter, I loved that job because it gave me the opportunity to talk with people and meet them where they're at in very difficult times in their life. And as a surgeon now, what I do is different. And obviously my roles and my responsibilities as a surgeon are different. But the one thing that has remained the same is the heart of the matter, and that's commitment to serving patients. As I've gotten the opportunity to start at Regional Hospital, I've met a lot of new faces, and one of the common questions that I get is, why Rapid City? What is it that brought you to this town? And for me, that's really an easy question to answer because there are really lots of answers to that question for me. But probably the most important one for you to know today is that at the age of 16, when I felt called to pursue surgery, I knew that part of that was going to be serving Native American people. My father is an Assiniboine Sioux. He grew up on Fort Belmont Reservation in north central Montana, and my mother is Lakota. She grew up in Eagle Butte and spent a good part of her childhood on Cheyenne River, and then later moved throughout the plains as my grandfather worked for the Bureau of Indian Affairs. But at the age of 16, I knew that I wanted to serve Native people, and I knew that my goal in life would be to have a positive impact on Native American healthcare. So when my wife and I sat down and we were looking at where we wanted to end up, Rapid City was obviously very high on that list because, as many of you know, about 30% of our patient demographic is Native American. And so working at Regional Hospital allows me to fulfill that goal in my life and to serve Native American people. And for that, I am extremely grateful. My father taught me when I was growing up that a person wrapped up in themselves makes for a small gift. And we need to envision our lives and have a bigger vision for our lives than just ourselves. And I believe that in serving other people, that's where we really find true meaning and true significance. I believe that a purpose will always be defined by service to others, because the pursuit of a calling is always an inward process that is aimed at an outward purpose. So our calling is defined by service, and our calling is defined by sacrifice. I've had the chance to have several people over to my home, and if I took you to my home today, you may see a beautiful home with a wonderful wife and great kids, and all of that is true. But how many of you know that it hasn't always been that way? And what you may not see is that those 3 kids were actually raised in a 600 square foot apartment with 1 crib in the living room and 1 crib in the closet, and crying babies everywhere as I was trying to take tests and be a father and be a husband. You wouldn't necessarily see that. You wouldn't see me at the gas station as I have to call my wife and say, hey, honey, how much money do we have? $16. Okay, I'm going to put 12 in my tank so that I can get us to Friday, because then I think we'll have a little bit more and we'll try and stretch this out. You don't see necessarily the fact that I so desperately wanted to take my wife out on a date for years but couldn't, because I was raising a family of 5 on about $15,000 to $20,000 a year. And so I know what sacrifice is, and I'm here to tell you that your pursuit of your calling will require sacrifice, because as I tell my kids, nothing worthwhile in life comes at a small cost. So the pursuit of your calling will be in service to others. It will require sacrifice, and it'll be scary. And that's okay, because it's supposed to be scary. Your calling should push you into uncomfortable situations. It should put you into positions that you don't necessarily feel prepared for. I remember it wasn't just a few years ago that I was a 3rd-year surgery resident and I was working on the pediatric surgery service. And for those of you who've been through training who know pediatric surgeons, you know that they are a different breed. And pediatric surgeons are very interesting characters, and they have big egos. And I was in this case, and we were operating on a 2-year-old child who had a mass that made up about 1/3 of his body weight, and it was an invasive cancer that had invaded many of his arteries and veins, and we were trying to peel it off of his renal veins. And as we're trying to get around that right renal vein and tie that right renal vein, for the anatomists in the room, you know that there's a big difference between the left renal vein and the right renal vein. The left renal vein is long and slender, and there's room for error, and if your suture isn't actually tied down perfectly, it's okay, because you can go back and you can fix it. But the right side is very different than the left. The right side is short, and it's stubby, and if you make a mistake there, then there are real consequences. And so we got around that vessel, and we placed the suture around there, and I got ready to tie that knot down, and the surgeon looked at me and he said, stop. And so I stopped. And he looked at me and he said, now just remember that if you tie this improperly, that this child can likely die in a matter of about 10 seconds from bleeding out. And how many of you can recognize that at that moment I was scared and there was fear inside of me? But I looked back at him and I said, well, I guess it's a good thing that I've been tying lots of knots over the past couple of years. And if you find yourself in situations that scare you, if you find yourself in uncomfortable positions, recognize that that is okay, because your calling should put you in positions that are scary. And when you're in those positions, remember that greatness is found in moments where preparation meets opportunity. So a calling is defined by service, A calling requires sacrifice. A calling is scary. The fourth thing that I would say to you today is that a calling supersedes. And what I mean by that is that your calling is not just what you do, but your calling is who you are. When my father was about my age, he had been a minister for many years up to that point, but he was really dealing with this idea of who am I and why am I here? And he found a hotel room, and he went into that hotel room, and he's basically said, I'm not going to leave until I answer these two questions. Who am I, and why am I here? And he came out of that experience with one word, and that word was example. And he felt called to be an example, not just to my family, but to the community of what it means to be a leader. And I had a similar experience over the past couple of years as I've tried to come to grips with the questions of who am I and why am I here. And as I've dealt with these questions and wrestled with that identity, the one word that always came back to me was healer. And I can tell you that as a surgeon, obviously what I do is I'm a healer physically. But more so than that, I feel like I'm a healer not just to the physical, but mentally, spiritually, emotionally, and in terms of the community. And if you were to take away my ability to practice medicine tomorrow, if you were to take me out of the operating room and say you can no longer see patients, that would be a travesty and that would be hard for me. But I can tell you that no matter where I'm at in life, whether it's practicing surgery or being a father, wherever I'm at in life, I'll continue to be a healer, because your calling is not just what you do, but your calling is who you are. So our callings should be in service to others. Our callings should come at a sacrifice. Our callings should scare you. They should stretch you. Your calling supersedes your profession because it's who you are and not just what you do. And the fifth thing that I would say is that your calling satisfies. I had the opportunity to meet somebody last week who came up to me and said, you don't know me, but I just want to say that you recently had the opportunity to take care of a family friend, and they had nothing but good things to say about that experience, and everything came out all right. And I say that not to toot my own horn, but just to say that it's small instances like that bring the most satisfaction in my life, that few other things in life can bring me. And it's a privilege to take care of patients. I consider it not a right but a privilege, and I just have to remind us of that, because while I've gone through the training and I have the right to practice medicine because of the things that I've been through, it's a privilege when a person comes into the clinic and entrusts you with their care. And I just have to say that when we take care of people, we need to remember that people coming to us and entrusting us with their bodies, entrusting us with their health care is not our right, but it's a privilege to be able to serve people in the community. I know that we're entering in upon football season, and I'm sure that everybody in the room knows Monday Night Football. Raise your hands if you know what Monday Night Football is. Everybody's going to raise their hand. How many of you in the room remember a guy named Howard Cosell? Anybody remember Howard Cosell? So Howard Cosell was a sports commentator, and he was one of the original sportscasters on Monday Night Football. And after watching sports competitions for years and years, Howard Cosell came up with one observation, and Howard Cosell said that the ultimate victory in competition is derived from the inner satisfaction of knowing that you've done your best and that you've gotten the most with what you had to give. And I believe that those words are true not just in sports, but I believe those words are true in life. And that the ultimate victory in life is derived from the inner satisfaction that we get of knowing that we've done our best and that we've gotten the most out of what we have to give. And I believe that there are people in the room that might come up to me and say, you know what, Jacob, I think that that's great that you have a calling, that this thing that you've pursued, but for me, I just come to work. For me, I've never felt pulled in any one direction, and I don't know what my calling is in life. I don't know why I'm here, and I don't know what it is that I'm supposed to be doing. And my advice to you today, and my encouragement to you, would be to say, that's okay. Because every person in this room has been at that point at one time or another in our lives. But my advice to you would be to look at the intersection of your passions and your abilities. And it's the same thing that I tell my boys. My boys are 11 years old and 9 years old, and they come to me now and they say, Dad, what do you think it is that I should do with my life? And I tell them, look at the intersection of your passions and your abilities, because I think that everybody is born with passions. There's plenty of people that love football, but they don't know how to throw a spiral, right? So we have passions, things that we're really in love with, and we have abilities, things that we're good at, and they don't always coincide. People have these amazing abilities in mathematics or communication, but there's really no passion for them. But if you're trying to find your calling in life, my encouragement to you would be to look at the intersection of your passions and your abilities. And in that intersection, I think that you're likely to find why it is that you were put here on this earth. I'm reminded of a quote from William James, who's the author, or the father of American psychology, who said that the greatest use of life is to spend it for something that will outlast it. And that's something that I've come back to time and time again in my life. And my question to you today is, are you spending your life on something that will outlast it? What kind of a legacy are you leaving? My hope for each and every one of us in this room today is that we may find ourselves in a position where we're able to serve others. A position that requires sacrifice at every turn, doing something which scares you to your core, knowing that the pursuit of that thing is likely to bring you satisfaction that few other things in life can offer. It looks like my time is up. My name is Jacob. Thanks for listening.